Okay, this video is called Drug-Induced Atrial Fibrillation. We're going to start with a quote by Arthur Koestler. He said, "The creative act does not create something out of nothing. It uncovers, selects, reshuffles, combines, synthesizes already existing facts, ideas, faculties, and skills. Some of the greatest discoveries, they consist mainly in clearing away the psychological roadblocks which obstruct the approach to reality. That is why, post factum, they appear so obvious." Okay, one more quote. "Psychoanalysis is the mental illness which regards itself as the treatment," by Karl Kraus. Okay, so the joke is that psychoanalysis makes the patient mentally sicker than they were to begin with. And I had other friends, my orthopedic surgery friends, who used to say to me that psychiatry is the only field in medicine where the doctor is usually sicker than the patient. Okay, and what's the relevance of all this to talking about atrial fibrillation? The point is, a lot of these medications significantly increase the risk of atrial fibrillation. Some of them commonly, some of them not so commonly. And of course, the sicker the patient is, the more likely a medication is going to be to induce atrial fibrillation. But nevertheless, that being said, wait till you see how many medications are associated with drug-induced atrial fibrillation. The abbreviation for that is DIAF. And of course, we know that mitochondrial inhibitors increase the risk of atrial fibrillation, but I already gave a separate lecture on that, so I'm not going to talk about that today. I'm just going to talk about other drugs, not specifically primarily thought of as mitochondrial inhibitors. Okay, and this is another reason why you want to optimize your health, so that you avoid these problems and you make yourself less at risk. Okay, here's one quote by Bruno Stricker. He's one of the guys who wrote one of these papers. He said, "Almost all drug-induced AFib has one of the following mechanisms. It's adrenergic, and that means excessive stimulation of sympathetic autonomic nervous system. If you have a sudden overstimulation of the vagal, you can also elicit atrial fibrillation arrhythmia." So sudden vagal overstimulation. Some meds are directly cardiotoxic, like some of the cancer chemotherapy drugs. Some change atrial conduction pathways, the refractoriness or automaticity of the cells, and some are just because they make atherosclerosis get worse, which will decrease blood supply, oxygen delivery to tissue, which will cause mitochondrial infarction, mitochondrial dysfunction, and electrolyte abnormalities. Like if you're on a diuretic like hydrochlorothiazide, for example, you'll pee out your potassium and your magnesium, and that will increase your risk of AFib. So one has to be careful. Okay, so here's some of the big papers. I told you about the one by Bruno Stricker. Here's a big AFib paper by Juan Tamargo, drug-induced AFib. Here's another big AFib paper by James Tisdale. So this is all easy to look up. And I just want you to get a sense of how many medicines can do it. So anything that increases cardiac, rate or cardiac contractility can do it, like all these ionotropic meds, dopamine, dobutamine, for example. Okay. If you're taking thyroid hormone replacement, if somebody takes too much of that for their hypothyroidism, that can induce AFib. Caffeine, coffee, tea, etc. Cocaine, pseudoephedrine for drying up the nasal sinuses. These asthma medications or COPD, chronic obstructive pulmonary disease meds, albuterol, samidorol, xanthine, aminophylline, theophylline, okay, or hexoprenolone. All that stuff. Smoking cigarettes, nicotine gum, nicotine. Okay, some of these vasodilators can potentially induce hypotension, leading to activation of a adrenergic reflex. Okay, forgot the O in there. All right, so isosorbide mononitrate is a more common one, but these erectile dysfunction medicines can do that too. Sildenafil and vardenafil, like Viagra. So a person would be best to be hydrated before that, one would think. Antiarrhythmic medications, here's some of them. You'll have heard of some of these. Some of them, that's really sort of a beta blocker, but, flecainide, these are all, in some use, okay? Antidepressants. Antidepressants, man, that's kind of a scary thing. And that's why it's dangerous to be on all these meds. All psych meds. Psych's one of the most overrated, perhaps the worst field in all of medicine. As the great Dr. Bregan said, all psychiatric drugs cause a lobotomy. Some do it quickly, some do it slowly. The antipsychotics tend to do it relatively quickly, in just a month. They can potentially do it, versus the other ones, they take longer, but still, they're neurotoxic substances. Okay, can you imagine giving amphetamines to a child? That's insane, okay? Absolute nonsense, but it's allowed because the medical system runs on atheism, which runs on hatred, rather than on Christianity, which runs on love. So you end up in these situations where money is more important than people. All right, well, anyways, migraine drugs can do it. These cholinergic drugs. We talked about diuretics leading to loss of potassium and magnesium in the urine. Corticosteroids can do it. Anabolic steroids increase the risk as well. So, of course, if the guy is otherwise very healthy, it's unlikely to happen. But the more unhealthy he is, the more hypertension, diabetes, or other comorbidities he has, previous myocardial infarction, that sort of thing, left atrial enlargement, etc., the higher the risk of inducing AFib. Also, of course, the older the guy is. All right. Chemotherapy drugs, man, they're like a disaster. They've got tons and tons of cardiac side effects. There's so many chemotherapy drugs and immune suppressant drugs for treating autoimmune disease that I just listed. What did I list? I listed about, how many of them? 54, and I stopped because my wrist was hurting. I was getting carpal tunnel syndrome from listing all of the chemotherapy type drugs. You know, they're poisons. They're designed to kill cells. They're major freaking poisons, all right? So you don't want to go down that path unless you have no other decent option. Should always ask, what are the results for this chemo? Because what patients don't understand, patients think, well, it's a standard treatment. It must be the best treatment. No. What it is the standard treatment. A lot of times the attitude is, well, the cancer patient's already dead, so we might as well try something, okay? But that doesn't mean it necessarily works, and alternative treatments have not been considered almost ever. So it'd be worthwhile to at least know how likely it is to work before you agree to it like a chump. Don't get me wrong, sometimes it's a good thing. Sometimes it could save your life, but you better well know that because a lot of times it's just given out of habit, and the patient never even questions it rather than ask. Marijuana, dangerous stuff. I've seen a lot of bad complications from marijuana. I've seen people have schizophrenic breakdowns from that, and that gets treated with antipsychotic, and the antipsychotic causes lobotomy. It's dangerous. Okay, so look at all these are unknown mechanisms. These opioids. Opioids can, of course, also cause overdose and hypoxia, all kinds of problems. Omega-3 fatty acid supplements increase the risk of AFib. Great. Omega-3 supplements are a big joke, okay? They just do all this testing and stuff to trick all the stupid, ignorant pros and sell them stuff like a bunch of chumps. Okay, anti-clotting medicine, some of them can do it like clopidogrel, like Plavix. That's kind of scary. The NSAIDs, especially in people who also have asthma and COPD, some of them have almost like a semi-allergic response to that stuff, like aspirin as well. Okay, let's see. Like I said, there's more of them than I could have typed. Usually you can make the diagnosis of drug-induced AFib because it happens right after they take the drug. You got a temporal relationship that's clear between the two substances. Sometimes it's not so clear and the patient's on multiple medications, in which case it's good to be aware of this concept that, so you can stop the drug quickly as long as there's not some other urgent reason why they have to be on it. But, AFib is a dangerous disease. I'll talk more about the side of AFib, but, 15% of patients dead in a month, 25% dead by the end of the first year if they're over 65 years of age at time of diagnosis. Plus, it can cause dementia, kind of scary. I'll explain why it can cause dementia in a future lecture because there's a little bit of interesting stuff to that topic. Okay, the more comorbidities the patient has, like diabetes, hypertension, atrial enlargement, obstructive sleep apnea, polypharmacy, previous MI, etc., valve disease, the higher the risk of drug-induced AFib. Okay, so that's it. I hope that was helpful.